Hello, everyone, and welcome to Sarita Air Crew Official. 6 signs you should never fly, especially if you're over 70. I know that title sounds pretty scary and maybe even a little extreme, but please stay with me because I'm not here to frighten you or keep you grounded. I'm here to prepare you and keep you safe. As a 15-year flight attendant with over 15 years of experience, I've seen medical emergencies at 35,000 feet, and I can tell you, many of them were completely preventable. The passengers involved simply didn't know what I'm about to share with you today. So here's the truth. These aren't actually never fly situations. They're don't fly until you've taken these precautions situations. Today, I want to share 6 medical conditions and circumstances that require special attention before you board that plane, especially if you're over 70, because you deserve to travel safely and enjoy every moment of your journey. Let's get started. Recent respiratory infection or serious congestion. First up, and this is something I see all the time, flying with a recent respiratory infection or serious congestion. Now, I get it. You've had this trip planned for months. Maybe you're visiting grandchildren or you've got a bucket list vacation booked. You wake up with a cold a few days before your flight and you think, it's just a little congestion. I'll be fine. Here's what most people don't realize. When you fly with congested sinuses or a respiratory infection, the pressure changes during takeoff and landing can cause excruciating pain. And I mean excruciating. I'm talking about pain that can literally bring grown adults to tears. In my 15 years, I've watched passengers clutch their heads, some even screaming, as we descend. The medical term is barotrauma, but basically, when your sinuses or ears are already blocked and swollen, the air pressure has nowhere to equalize. It can rupture your eardrum, cause severe sinus damage, or lead to infections that take months to heal. And here's the thing. This affects older passengers even more severely. As we age, our eustachian tubes don't work as efficiently, and we're more likely to have underlying sinus issues or allergies. What might be uncomfortable for a 30-year-old can become a medical emergency for someone over 70. I once had a passenger, a lovely woman in her mid-70s, who flew with what she thought was just a head cold. By the time we landed, she had such severe pain that we had to call paramedics. She ended up with a ruptured eardrum and a sinus infection that lasted for weeks. She told me later, if I'd known, I would have rescheduled my flight in a heartbeat. So here's my advice. If you have serious congestion, a sinus infection, or you've had respiratory symptoms in the past week, talk to your doctor before flying. They might recommend waiting a few days, or they can give you specific decongestants or nasal sprays that can help. Sometimes that's all you need, just a proper game plan. Your ears and sinuses will thank you, I promise. Uncontrolled high blood pressure or recent heart event. Let me break down something that airlines won't always tell you clearly. Flying puts extra stress on your cardiovascular system, especially if you're over 70. At cruising altitude, the cabin pressure is equivalent to being at about 6,000 to 8,000 feet above sea level. That means there's less oxygen available, even though it doesn't feel like it. For most healthy passengers, this isn't a problem. But if you have uncontrolled high blood pressure, or you've recently had a heart attack, stroke, or cardiac procedure, this reduced oxygen can be genuinely dangerous. Here's what we're trained to look for as flight attendants. Signs of cardiac distress, shortness of breath, chest pain, sudden weakness, confusion. And I've seen it happen more times than I'd like to count, especially with passengers who didn't realize they were at risk. The general medical guideline, and this is something your doctor should tell you, but often doesn't, is that you should wait at least 2 weeks after a heart attack or stroke before flying. Some cardiologists recommend even longer, depending on the severity. And if you've had recent heart surgery, you're looking at waiting 4 to 6 weeks in most cases. But here's what concerns me even more. Passengers with uncontrolled high blood pressure who think they're fine to fly. We see this every single day. Your blood pressure might be manageable on the ground, but the combination of cabin pressure changes, reduced oxygen, dehydration from the dry cabin air, and the stress of travel can cause it to spike dangerously. I'm not a doctor, but I've been trained in medical emergencies, and I can tell you we carry defibrillators on every commercial flight for a reason. We hope we never have to use them, but we do, more often than anyone wants to talk about. So please, if you have high blood pressure, make sure it's well controlled before you fly. If you've had any recent cardiac event, get explicit clearance from your cardiologist. Ask them specifically, is it safe for me to fly? Don't assume anything. Your heart is precious. Treat it that way. Recent surgery, especially abdominal or eye. This is one that surprises a lot of people, so pay close attention. If you've had recent surgery, especially abdominal surgery or eye surgery, flying too soon can cause serious complications. Here's the science behind it. During flight, the gases in your body expand because of the lower cabin pressure. If you've had abdominal surgery, gallbladder removal, hernia repair, appendectomy, any kind of intestinal surgery, those expanding gases can put pressure on your healing incision site. In the worst cases, this can cause wound dehiscence, which is a fancy medical term for your surgical site literally opening back up. I've had to assist with this exact situation. A passenger who'd had surgery just 10 days prior felt something pop during our climb to cruising altitude. It was terrifying for him and genuinely dangerous. We had to coordinate an emergency medical consultation with a doctor on the ground, and he required immediate medical attention after landing. The general guideline is to wait at least 10 to 14 days after major abdominal surgery before flying. But here's the thing. Many surgeons don't specifically mention this to their patients. They'll say, take it easy, or no heavy lifting, but they forget to say, oh, and don't get on an airplane. Eye surgery is another big one, particularly cataract surgery or retinal procedures. The pressure changes can affect the gas bubbles that surgeons sometimes use in these procedures, and it can damage your healing eye tissue. For most eye surgeries, you're looking at waiting anywhere from 1 to 6 weeks, depending on the specific procedure. My advice? Before any surgery, specifically ask your surgeon, how long should I wait before flying? Get it in writing if possible. And if you absolutely must fly sooner than recommended, talk to your doctor about a Fit to Fly certificate and what precautions you should take. Don't leave your recovery to chance. Deep vein thrombosis, DVT, risk without a prevention plan. Let's talk about something that doesn't get enough attention. Deep vein thrombosis, or DVT, which is basically blood clots that form in your legs during long periods of immobility. Here's the reality. Sitting in an airplane seat for hours, especially on long-haul flights, significantly increases your risk of developing blood clots. And if you're over 70, your risk is even higher. Add in other factors like recent surgery, a history of blood clots, cancer, obesity, or being on certain medications, and that risk skyrockets. A blood clot in your leg is serious enough, but the real danger is when that clot breaks loose and travels to your lungs. That's called a pulmonary embolism, and it can be fatal. I don't say that to scare you, I say it because it's true, and you need to know. We flight attendants are trained to recognize the signs of DVT, swelling in one leg, pain or tenderness, redness or discoloration, warmth in the affected area. But by the time we see those symptoms, the clot has already formed. The key is prevention. Here's what most passengers don't realize. If you're at high risk for DVT, you should not fly without a prevention plan. Period. That plan might include compression stockings, which improve blood circulation in your legs. It might include a low-dose blood thinner that your doctor prescribes specifically for the flight. It definitely includes getting up and walking the aisles every hour or two, doing ankle rotations and calf stretches in your seat, and staying very well hydrated. I once had a passenger, a gentleman in his early 70s, who told me he always wore compression socks on flights because his doctor recommended them after he'd had a clot years before. He said, "It's a small inconvenience for peace of mind." That's exactly the right attitude. If you have any DVT risk factors, talk to your doctor before booking that flight. Ask specifically about compression stockings and whether you need prophylactic blood thinners. Don't fly without this conversation. Your circulation matters. Protect it. Severe mobility issues without proper arrangements. This next one is difficult to talk about, but it's absolutely critical. Severe mobility issues without proper advance arrangements. Let me be clear about something. Having mobility challenges does not mean you can't fly. Thousands of passengers with wheelchairs, walkers, and mobility limitations fly safely every single day. But flying safely with mobility issues requires planning and proper arrangements. Here's what many passengers don't consider. In the event of an emergency evacuation, we need to get everyone off that plane in 90 seconds. That's the FAA requirement. The aisles are narrow, usually only about 18 to 20 inches wide. The exits require you to step up or down, sometimes several feet. There are no ramps. There's often no jet bridge if we evacuate on the ground. If you have severe mobility issues and you haven't notified the airline in advance, you're not just putting yourself at risk, you're potentially putting everyone on that plane at risk. And that's not a judgment. That's just the physics of aircraft evacuation. Here's what I need you to understand. Airlines have procedures and accommodations for passengers with mobility challenges, but they need to know in advance. When you book your flight, notify the airline about your specific needs. Request an aisle chair if you can't walk down the aisle. Request pre-boarding so you have extra time. Request assistance to and from the gate. If you use a wheelchair, understand that your chair will be gate checked and you'll be transferred to an aisle chair or carried to your seat. If you cannot walk at all and cannot transfer yourself, most airlines require you to travel with a companion who can assist you in an emergency. I know this might sound harsh, but I've seen situations where passengers with severe mobility limitations board without warning us, and it creates a genuinely unsafe situation for everyone. We want you on that plane, but we need to be prepared to keep you safe. Also, and this is important, if you're seated in an exit row, you must be able to operate that exit in an emergency. If you have any mobility issues, vision problems, or you don't feel confident about this responsibility, do not sit in the exit row. We'll ask you directly, and please be honest with us. Planning ahead isn't a weakness, it's wisdom. Unmanaged anxiety or claustrophobia. Finally, let's talk about something that affects more people than you might think. Unmanaged anxiety, panic disorders, or severe claustrophobia. I want to approach this topic with sensitivity because I know anxiety and panic are very real medical conditions. They're not something you can just get over, and they deserve proper treatment and respect. Here's what I can tell you from experience. We have medical emergencies from panic attacks more frequently than most people realize. When someone has a severe panic attack at 35,000 feet, especially someone older who might also have cardiovascular concerns, it can mimic the symptoms of a heart attack: racing heart, chest pain, difficulty breathing, sweating, dizziness, feeling like you're going to die. When this happens, we have to treat it as a potential cardiac emergency until proven otherwise. I've been involved in multiple flights where we've had to divert to the nearest airport because a passenger was having what appeared to be a medical crisis, only to discover it was a severe panic attack. Now, having anxiety doesn't mean you can't fly. But having unmanaged, untreated anxiety or claustrophobia that you know will be triggered by flying, that's when you need to have a conversation with a mental health professional before you book that ticket. Your doctor might prescribe anti-anxiety medication specifically for flying. They might recommend therapy techniques like cognitive behavioral therapy or exposure therapy. They might suggest shorter flights, first to build confidence. There are many options available. What concerns me is when passengers know they have severe anxiety, don't seek help, don't take medication, and then board the plane hoping they'll be okay. Hope is not a strategy when it comes to your health. Also, please know, we flight attendants are trained to help. If you're feeling anxious, tell us. We can talk you through it, we can get you water, we can help you find a distraction. We've seen it all, and there's no judgment. But we can help you better if you've also prepared yourself in advance. And here's something else. If you're considering alcohol to calm your nerves, please don't. Alcohol at altitude affects you differently, and it can actually make anxiety worse. Plus, it dehydrates you and can interact badly with medications. Take care of your mental health with the same seriousness as your physical health. Both matter enormously. So there you have it. 6 situations where you should think very carefully before flying, especially if you're over 70. But remember what I said at the beginning. These aren't never fly situations. They're make sure you're prepared situations. With proper medical consultation, advanced planning, and the right precautions, most people in these circumstances can fly safely. The key is being honest with yourself and your doctor, planning ahead, and never being afraid to ask for help or accommodations. Your safety is always the priority, not your ticket price, not your schedule, not inconveniencing anyone. Your safety. If you found this information helpful, please subscribe to the channel so you don't miss future travel tips and insider advice. I share everything I've learned in my 15 years as a flight attendant to help you travel smarter and safer. And let me know in the comments. Have you ever had to postpone a flight for medical reasons? What was your experience? Your stories help other travelers make better decisions. Travel is one of life's greatest joys at any age. Let's make sure you're doing it safely. Safe travels, everyone, and I'll see you in the next video.